Tehila, Zambia, we believe in a community-driven approach. We do a lot of safeguarding trainings in the churches, organizations, and schools. And the more we do the training, we were seeing cases coming to us that we had to respond. And in the process, we established what we call the Shalom Center at our offices in Lusaka. But because we believe in a community-driven approach, we wanted to have an innovation that was community-based. So we set up Shalom Hubs. Our Shalom Hubs are set up in the communities. These are playgrounds, community play spaces that would build safeguarding processes for children. We want to work with the children in the communities, but we didn't want to take quote-unquote professionals to go and provide safeguarding solutions at community level. So we now had to work with the people in the community, train them in counseling skills, train them to be able to handle mental health issues. They can handle paralegal support services when people want to refer the cases to the police or go to the courts of law. We want community members who are well trained and can be able to handle that. And being a faith-based organization, we also are asking, how can the church be part of this journey? How can the community and the church work together? Shalom centers, Shalom hubs are set up at local churches in the communities that we work with. When you visit these places, children know them as a playground. Children, when they come in, they know that they are not coming to a counseling center. They come to a place where we offer discipleship courses, girls mentoring, boys mentoring. We do parenting support skills, and many other activities that support the community. We use a very simple tool that we call a play box. When a child is having issues, they would sit down with a counselor, and they can tell their story just on the play box. The facilitator could start it off and just give them a space where they could share their fears, their suffering. As they use different tools that are used in the play box, a child is able to tell their stories, and then they can go on the journey of healing. What we have found very powerful about this is that we are not taking specialists in the communities, but we are using the people that the children know. We are using the mothers, we are using the fathers, we are using people, familiar faces that they know, to come and talk to come and play with and share their stories. We found that this has really helped us, because when we are having that as a way of responding to children who are survivors of abuse, they are not going to places where they will meet people that are not familiar. We had a case of a child that had experienced abuse. The father came and withdrew the child and took her to a very big hospital for support. The child refused. The child says, I want to go to a place where I'll talk to auntie, where I'll talk to people that I know. And the father was surprised, and he came, said, I was willing to pay so much money to do this, but my child has told me, let us go to the place where I know the people that I'll talk to. Because of the relationship, the children have been coming there, they have been playing with some of the people that are supporting them, and they feel it's a very safe ground, and they are able to share their stories and receive the help that they can get. Thank you.